Hey there. Okay, today we're talking about the second chapter of this book. The chapter is Gaelle Fiasse's Ricoeur's Medical Ethics, the encounter between the physician and the patient. Now, the chapter itself is really long and there's a lot of technical terminology. Today we're just going to get at the key points. I elaborate on things a bit more, quite a bit more in the handout, which you should have read and have with you while we're going through the lecture. Okay, and you should also have snacks. Okay, so basically Ricoeur says, look at what should medical ethics be? Medical ethics should involve the patient's narrative as a key component of their relationship with the doctor. Doctors should pay attention to patients. Doctors should listen to patients, and basically this will make the treatment go a lot better. So what is going on here? Well, big picture. Ricoeur says, look at an ethical life involves three components. It involves the striving for a good life. It involves a recognition that we are living with others, that others are part of the world, that we are not an island. And three, that an ethical life, if there are good and fair institutions, it will be better. What is an institution, you might say? An institution is like, well, as university students, you are dealing with the institution of Purdue Fort Wayne. Your life as university students will be better if that institution, Purdue Fort Wayne, is functioning well, functioning like a university should. For patients, medical patients, their experiences will be better if the medical institution, the hospital, is functioning properly. Okay, now how do these three aspects directly apply to medical care? Well, the first, that we should all live good lives. Okay, that in a doctor-patient relationship, this means that physicians are partners of a common struggle. The patient and the physician are partners in a common struggle to care for the patient. And in this sense, the physicians are not only curing a disease or solving an interesting case, but they are dealing with a unique individual who is suffering. Doctors should listen to patients. Second, Ricoeur suggests, look at the doctor and the patient must recognize that they are in a pact together. Now, in any sort of clinical relationship, it seems that the doctor has so much more authority and the patient has no authority. The patient is really treated as second class. Like I go to the doctor and I'm like, Doc, I feel like shit. I don't know why. Help me out. And the doctor has years of medical experience and years of medical training, and they seem to be an authority figure. Ricoeur suggests that we make this more equivalent, that the doctor and patient maintain a certain sort of camaraderie where they are partners attempting to solve a big problem, the problem of the patient's illness. Now, the third aspect involves following rules for the doctor. The doctor should always use rules as a form of self-critique. Am I doing my job to the best of my abilities? Am I living up to the standards of my profession? Now, this talk of rules brings up this figure, Immanuel Kant. Basically, Ricoeur says, look at my medical philosophy, my medical ethics involves some aspects of Kantianism and some aspects of the Golden Rule. Well, you might be wondering, who the hell is this Kant guy? Kant was a German idealist, and all you have to know about him is that he was a moral absolutist who thought that there were rules that determine all morality. What is a rule for Kant? A rule is something that applies across the board. It applies universally. It applies everywhere to everyone. Now, that means, look at, if there is a rule, it applies to everyone. Sounds great, right? Like maybe the rule should be, hey, doctors should treat patients. Everyone. Any patient that's sick should get treatment, regardless of wealth, regardless of gender, regardless of religious belief, regardless of whether or not what that patient has done with their life, regardless if they're a criminal or a saint. They should get treatment if they are sick. That's great. That's the part of Kant that Ricoeur adopts. What Ricoeur rejects is this problem with rule followers that they seem to pay more attention to the rule than they do to the concrete situation that they are in. Rule followers can be real pricks. They can simply suggest, hey, you know what? I'm following the rule and that's life. And I don't care what your particular circumstance is, I only care about rules. They give more respect to the rules than they do to the person that they are dealing with. Ricoeur says we got to push back against that, so he suggests the golden rule be included in his ethical theory, which is basically the doctor should approach every patient and say, hey, okay, how would I like to be treated if I was a patient? That's how I'm going to act towards this patient. How can I help this patient be a human being, knowing that everybody likes to be treated like a human? So the Kantian aspect of Ricoeur's medical ethics is, look at, everybody should be able to get treatment as if they're sick. And what is the golden rule aspect? That when you are treating a patient, you treat them like a human being. You give respect and care to them in their unique situation. Now, this leads to 3 precepts that apply. Now, what is a precept and how does it differ from a rule? As we just said, rules have universal scope. Rules apply everywhere, and the second property of rules, the second thing you need to know about a rule, is it never changes. How can you remember this? Well, a mathematical rule. Oh, like, what is a plus sign? What does a plus sign do? This applies just as much as it did in ancient Greece as it does in 21st century America. Another mathematical rule would be like, or a geometrical rule would be, hey, the 3 sides of the 3 internal angles of a triangle equal 180 degrees. It doesn't matter where that is. If it's in ancient Greece, ancient Egypt, ancient China, present day China, or present day America. What is the value of pi? That applies everywhere. Mathematical pi, not blueberry pi. So rules never change and they apply everywhere. Well, precepts are changeable. Precepts are recommendations, they are guidelines that alter based on the particular experience one is in. And Paul Ricoeur suggests 3 precepts that should apply. 1, to medical ethics. 1, the precept of singularity. This claim is that every patient is unique. No 2 patients are identical, and every patient, you should listen to their life story and celebrate their uniqueness. You should not just treat them as another guy who has a virus or another person that has a heart condition. You gotta understand what's going on in that person's life. You must recognize that they have all sorts of shit going on, and take account of that in your diagnosis of their illness and your treatment plan. Like, you're not going to suggest to a guy that has 1 leg that he do more running to lose weight. Right? You got to recognize each person as unique. Second, indivisibility. This precept basically says, look, this is the same thing that was discussed in the previous lecture. You cannot reduce a person to their component parts. But doctors treat humans, not merely diseased organs or malfunctioning parts. So there's an indivisibility about the human being that doctors must recognize. Doctors must look at the big picture of a person's life, as opposed to, well, you have a heart that has the arteries are calloused. Well, no, you got to look at the bigger picture of who this person is. 3, esteem. The doctor in every case should recognize that humans need their self-esteem bolstered, and that patients are feeling very vulnerable in any particular situation, and they're feeling like they're worthless, they're feeling like crap, they're sick, and you got to do something to encourage them and make them feel like they are doing okay, that they are going to get better, that this is possible to do. You can't make them feel like victims. These are the 3 precepts that Ricoeur suggests, and a precept again is a guideline that is changeable in particular situations or circumstances. Now, the concrete outcomes of Ricoeur's medical ethics. Let's face it, going to the doctor is scary. An encounter with healthcare institutions can make a person feel very vulnerable. Ricoeur's medical ethics aims to alleviate the patient's sense of fragility. The Kantian aspects of Ricoeur's philosophy demand that healthcare professionals treat any patient who requires medical aid. Any patient, regardless of who they are, regardless of what they've done, regardless of their religious beliefs. And Ricoeur's emphasis on precepts aims to produce clinical situations in which patients' uniqueness and sense of self-worth are allowed to flourish. Ricoeur holds that if these things occur in a medical situation, it will be better for everyone involved, and it will yield better outcomes for medicine. Okay, that's it. I hope you enjoyed the lecture, and now please review things and answer the discussion question, which is on Blackboard. Thank you very much.